You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families and medical providers, doctors, case managers, social workers, nurses find the right solution for seniors in transition. Whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed, we assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder process can be. And I wanted to be a guide and a resource for both families and professionals. Each year on Navigating Elder Care, we tackle the real solutions and challenges that families and providers face during care transitions. I have spent the last 30 years working as a registered nurse, specializing in geriatrics, and I have dedicated my career to advocacy and care transition planning. This podcast brings together my experience and passion to support you on your journey. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, and providers to create a customized care plan when someone is needing care assistance with activities of daily living, such as bathing, dressing, toileting. We learn what their care needs are, budget, location, their unique situation. We provide them with options such as residential care homes, assisted living communities, memory care. We advocate, guide, and educate throughout the entire process. Most importantly, we provide ongoing solution and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we are going to talk about creating a caregiving plan. Having a care plan well in advance allows families to get organized, locate appropriate resources, and be prepared when a crisis hits. A care plan is a thinking through every step of what you or your loved one is going to need as you or they age and you are starting to need more care. And we have mentioned this in previous shows. Over 70% of those turning 65 are going to need some type of assistance with their activities of daily living, such as bathing, transfers, mobility. Caring for a loved one or a family member is one of the most important roles you will ever have. You may begin by seeing your loved one needing assistance with grocery shopping, driving them to the doctor. You may later find yourself spending more and more time in their home, cooking their meals, paying bills that forgot to be paid. You or your loved one will find it easier to navigate the caregiving journey if you have a framework that can guide you. This guide can help you with information, checklist, and resources to help you become organized and find support. So what is a care plan? What is a caregiving plan? A care plan outlines your care needs and your loved one's care needs. It can be for your mom, your father, someone that you care about, somebody older, or for yourself as you are aging. And as we are talking about creating a caregiving plan, you will have the opportunity to download my ebook on a link that I will share with you, and you will also have worksheets that accompany the ebook to help you plan for future care needs. Care plans are different from a plan of care which your loved one's doctor will provide for you at a visit or after a hospital stay. A caregiving plan helps you prepare for non-medical needs, arrange care outside the home, bring in support. It prepares you for future care needs and transitions. This can lead to better communication, self-planning, and less stress. At some point, most older adults will need some type of assistance to get through each day. This means requiring assistance with basic care needs, personal care, bathing, walking. Medicare does not pay for long-term care, what they call custodial care. Most families do not begin planning for this type of care until they are faced with a health crisis. This can lead to a lot of unnecessary stress, disagreements. Having a care plan well in advance allows families to get organized, locate appropriate resources, and be prepared before a crisis hits. A care plan, again, is a thinking through of every step, every resource, and every option, every care option of what you or your loved one is going to need as they age to ensure safety and that you are prepared for such an event if you were to need care. Some of the topics to explore before creating a care plan. Most importantly, starting the conversation. So start the conversation. And many of us often wait until a crisis occurs before we discuss our loved one's values or our own values, preferences, healthcare wishes, or financial details. Waiting until you or your loved one has a serious accident, fall, or diagnosis to make a big decision like this can lead to many assumptions, a lot of anxiety, and a lot of stress. You can avoid all this by speaking to your loved one before anything happens. These conversations are very difficult, so it's easy for us to avoid them and to delay them. We never feel that it is the right moment to discuss a topic we believe can be uncomfortable. But it may surprise you that your mom or dad or your older aunt may be ready to have this conversation and may be wanting to talk about this themselves. This brings us to another important topic in creating a caregiving plan, that is assessing the current situation. You can determine your next steps by determining what is important for your loved one, such as where would they like to live or what type of care they will be needing. This can help you find resources in advance. You may find that your loved one is reluctant to reveal details about their finances or their health. Approach them with respect and explain what your intention is. Assessing, preparing, and planning for future care needs is vital, and I really believe that this is an act of love. You are acting in good faith, just for you to get all the information and know how to help them when future needs arise. It is important to plan ahead and decide how you or your loved one would prefer to be cared for and what their wishes are. Another topic that is included in a caregiving plan is something that families overlook, and it's hard to talk about. Reviewing your loved one's finances. Examine finances. Money can be such a sensitive subject, but it will play a key role in many decisions you will need to make with your loved one about housing, healthcare, and other related expenses. Family caregivers, they may find it surprising to learn that Medicare and insurance policies don't pay for assisted living. They don't pay for day-to-day care, such as in-home care that covers activities of daily living, bathing, dressing, support with toileting. Find out if your loved one has investments, insurance coverage, any loans available that may cover potential future care needs. Furthermore, inquire as to any long-term policy, any long-term care insurance policies and assets that could potentially cover future care needs, such as care in the home, paid caregivers in the home, or future assisted living needs. What is your loved one's income? Does your loved one have savings? Does your loved one have a long-term care policy? Can they access any money, any potential loans for future care? Will other family members assist with care expenses, with future care expenses? Does your loved one qualify for any government assistance, such as veteran benefits, Medicaid, or any state programs in your area? Do you know how to plan ahead for future care needs from a financial aspect? These are difficult questions, but they are so vital and important to know. Know that Medicare doesn't cover cost of assisted living or long-term care, but there are several ways that you can pay for this. And I'll mention a few, and in other episodes we will get more in depth about different ways to cover for long-term care, which is assisted living or any care in the home. So one is VA benefits. Number 2, long-term care insurance. Number 3, Medicaid. And of course, you have to financially qualify for that. And the most popular one is, of course, private pay. And there are other ways to pay for care, and we'll dive into those in a future episode. Another key part of creating a caregiving plan is just staying home, aging in place. So consider that when you're creating your care plan. Almost everyone wants to and prefers to stay in their home as they age, something we call aging in place. This means relying on family members for care or paid in-home care, caregivers in your home that are providing services to you in your home. This can get expensive very quickly. Nationally, a full-time caregiver, 24 hours per day, is about $20,740 per month. That is a national average. There can be a lot of variations between states. Adaptations can allow an older person to remain in their home if they are disabled or need assistance. Some changes may be simple, such as removing throw rugs that can cause falls, removing clutter, reorganizing a living space. Other changes like whitening doorways, modifying a bathroom, a shower, those can get expensive. The sooner you get this evaluation, the more time you will have to plan and pay for this. And we'll also bring a local resource expert that can talk about aging in place in a future episode. Another important piece of planning and creating a caregiving plan is consider assisted living and care options outside the home before a crisis happens, because not everyone is going to be able to stay home or have the luxury of staying home. Financially, it can get very expensive. Even if the home supports aging in place, other factors may not allow you to stay home. So consider how the older person will socialize and be socially engaged, get groceries, and make it to health appointments if they can no longer drive and they are home. So that is where an independent living or a senior living community, such as assisted living, that provides more amenities, more companionship, more resources, care and safety can be important. If you have ever been concerned about your aging parent or your loved one living on their own, you may want to explore senior living options for their care and safety. Researching this type of care is often a new concept for many families. When we are talking about senior care, we typically, we only think of nursing homes, right? But know that there are so many more options out there. There is independent living, assisted living, memory care. There is respite care, which is a short-term stay. There are also residential care homes. So there are many options out there for someone to receive care outside the home. All of these are month to month. There are no contracts. It's something you can you can try for a few months and see how things go and see if this is the right care setting for yourself or for your loved one. Researching these and having a plan in place is another step. For more detailed information about this, you can contact me. I can walk you through all of these steps and give you many care options. Think of this as a foundation, right? Creating your care team. That's another great topic. One of the topics of creating a caregiving plan. A caregiving team is needed to support you and your loved one. The extra support ensures your loved one's care needs are consistently met, even when you are unavailable. It also gives you an opportunity for respite care when necessary. Your care team should designate one person for each area of your loved one's care. They won't be completely responsible for everything, but think of it this way. Maybe your sister can be in charge of all the medical appointments. Your other sister can be in charge of groceries and housekeeping, etc. Nobody should take this responsibility of caring for someone alone. Other family members may be a source of help. And do not ignore friends, coworkers, neighbors, any religious or other affiliations. Everyone can help and can support. It's okay to ask for help. You can get help from local organizations as well, and resources if the care required is greater than what you and your care team are able to provide. For all those resources, you can visit my website, advocatern.com. Go to the resource tab, and you will find all of those resources there. Community resources are available. Many age-related support services are available for people of all ages. You can find out what the services are, like adult daycare centers, home-delivered meals, transportation, private care management. You can also visit eldercare.gov to find out what services are available in your area. You can also consult a local elder care professional to streamline the search and locate the right resources and care needed. Many times the needs of a loved one can be complicated, especially when emotional, financial, and health issues are involved. This is also overwhelming. At Care Advocates, we can help you identify what is needed, locate services, arrange care, and access all the care options, and all of the Medicare-covered resources as well, such as visiting physicians at home, home health, physical therapy, occupational therapy coming into the home, hospice services, palliative care. There are so many other services that are provided under your Medicare benefit. Here is when planning really makes a difference when creating a caregiving plan for your loved one, and that is caring for yourself, the caregiver. This is one of the most important topics. You must take care of yourself before you can advocate for and care for those that you love. Do not underestimate the impact that caregiving has on you. It can be difficult to manage caregiving responsibilities alongside your own work, your own personal family, your own personal obligation. Families who provide care often mention that the hardest part of it all is balancing the demands of work, family, their own personal life, and being a caregiver for your mom, your dad, or a loved one. The demand for their time, stress can have a negative impact on your health, well-being, and the ability to care for others. Ohio State University, in collaboration with the National Institute of Aging, did a study and found that caregivers exhibited biological changes indicative of accelerated aging. According to the researchers, this could amount to a shortened lifespan of 4 to 8 years compared to that of non-caregivers. So meaning that you are going to age more rapidly than the person you are caring for. It's important to recognize the emotions that you are feeling. You may feel differently about your experience as a caregiver depending on how you got involved as a caregiver. If you have always felt close to your loved one, let's just say your mom, you may see the role as a way to return their love. Others may feel resentful at being forced into a responsibility that they never wanted, that now they're responsible for because they have their own work, their own family, their own responsibilities. Some people enter caregiving reluctantly, and others find that it is an opportunity to heal a distant and broken relationship. It doesn't matter how you got into this role, but it is important to understand your emotions and be able to provide that self-care that you deserve so that you don't have caregiver burnout. Take time to enjoy yourself and find ways to reduce the stress if you are a caregiver. When you care for yourself, you're often better equipped to care for others and others that you love. So whether you are in the same city caring for a loved one, or even more complicated if you're in a different city, coordinating care for your loved one when you live outside of where they're at can get expensive, frustrating, and time-consuming. So always know that you have a lot of local resources that can help you regardless of distance. You have social workers, nurses, and other professionals that can guide you in selecting appropriate care options and monitoring the delivery of that care for those that live far away. Also, technology such as personal emergency response systems, remote monitoring devices, mobile applications, all of that can help you and can assist in keeping up with your loved one's many tasks necessary for long-distance caregivers. So utilize what you have as far as technology goes that can help you monitor your loved one from far away. And lastly, creating and completing what we're talking about, the caregiving plan, is the first start. It's a first step. Download the caregiving plan worksheet, the needs assessment. You can find that on my website, and I'll repeat that again at the end of the show. And that is a great start. It gives you a roadmap of what to do next. When creating a caregiving plan, there are very important things that you must have and know and enter into the worksheets that you can access and download. So number one is your loved one's physical health. Does your loved one have health conditions such as heart problems, high blood pressure, diabetes, or arthritis? What medications does your loved one take to manage those conditions? Do they need reminders to take the medications? Another key part is understanding your loved one's mental health. Does your loved one have depression, anxiety? Do you think your loved one should be receiving mental health support or mental health counseling? And know that a lot of this can come into the home as well. When you're building out this care plan, identify your loved one's care needs. Can they move about easily and safely around their home? Do they need help with bathing, shaving, dressing, transferring, toileting? What other personal activities of daily living do they need help with? Can your loved one cook for themselves, manage light housekeeping? What kind of care do they really require? Will you be the primary caregiver? Will any siblings be assisting you? When will your loved one require help, and for how long? Another thing also to think about is will you need extra help from a paid caregiver? So all of those are questions that you cannot answer yet, but it's good to start writing them down and putting them on paper so that you have some plan when these needs do arise. Can your loved one seek assistance in an emergency? Can they use a phone? And many times it's hard to recognize any of this because we only see our loved ones for a little while, but it's in those moments where you're visiting and you're spending hours or an entire day that you realize where all the gaps are. It is also essential to understand your loved one's ability to manage their finances. Can they manage their finances without your help? Do they remember to pay bills? What is their monthly income and expenses? Does your loved one have a savings account? Who will pay for their future care needs? Where does your loved one save all their financial records, titles, insurance plans? All of this is important to know and important to write everything down. So if your loved one is hospitalized or has a serious accident, you know where all of this is because you would have created that caregiving plan. All those worksheets are going to be filled as best as you can. And when a crisis does hit, you know where to go to find most of these answers. It's also important to understand your loved one's health and legal matters. Does your loved one have a long-term care policy, any supplementary policy, life insurance? Does that plan cover the cost of non-medical care and future care needs? And by non-medical care, we are talking about assistance with bathing, dressing, transferring, etc. What insurance does your loved one have? Does your loved one have a will, a trust, estate plan, or advance directives? Has your family arranged a healthcare proxy or power of attorney? Can you access these documents? Where are they? It's important to know all of this. Again, if a crisis happens, all of this is done. You know where to go. You know where it's at. Many aspects of caring for your loved one requires a collaborative approach between family members, legal professionals, and of course, your loved one. Another important piece of a care plan is safety in the home. Is your loved one's home safe? Is it free from clutter? Are there extra rugs, extra furniture that needs to be moved around? Are there secure handrails? Do they need handrails? What about lighting at night in the hallways? Is there an upstairs area that maybe is unsafe? If your loved one is living alone, can they call 911? How do they call 911? Look at their lifestyle as well. What are your loved one's hobbies? Does your loved one engage in any social activities? Do other relatives, community, neighbors support your loved one throughout the day, throughout the week? Are they isolated? Create your caregiving team and support system. So this is so important. Who is going to assist your loved one, your mom or dad? Assess each individual's strengths. Add some professionals into your team. Maybe that's a physician, elder law attorney, a geriatric care manager, financial advisor, social worker, pharmacy, maybe your home health care team, therapy, occupational therapy, any other charities, organizations, and assign roles and responsibilities to each of these members. So it's not just about you or your sister helping your mom or your dad, or it's about bringing support into the picture, into the care plan, and having all of these professionals there that you can access when a crisis does happen or when care is needed or questions need to be answered. Finally, we can't forget the most important thing, which is you, the caregiver. Consider your situation before you take on the role of the family caregiver. There are a few things you should ask yourself. It's best to involve your family as you are creating a caregiving plan. They might offer some helpful insight. You may not have noticed or even volunteered to help with some of the responsibilities. Does your current schedule allow for the time commitment caregiving requires? Will you be able to afford to care for your loved one financially and to still manage your own responsibilities? Can you manage your loved one's personal care, or will you need to hire a caregiver or bring care into the home? Do you have a reliable support system? And to answer all of these questions and kind of piece the puzzle together and put everything in the same place, again, it's good to create a care plan. Develop your care plan, your caregiving plan. Once you have a care team and a reliable support system, you can move on to creating this care plan. Not only should it account for your loved one's needs, but it should also address anyone else involved in their care. Care Advocates is here to help you find the right care at the right time, whether it is assisted living, memory care, or bringing trusted resources into the home. We walk alongside you every step of the way. At Care Advocates, we meet with you personally. We create a customized care plan. We discuss care options that fit your needs. We provide ongoing solution and support. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me, Laura, at 210-669-2222. Be sure to subscribe, like, and share this podcast, and visit advocatern.com for helpful resources. If you have a question or an idea for a future episode, you can email me at laura@advocatern.com. You can also listen to past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Elder Care, helping you find the right care at the right time for the people that matter the most.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email laura@advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.